Do you know that the global alarm about the COVID-19 pandemic was sounded first not by a human, but by a computer? Indeed, on December 19th, EarthMap, a website using AI to scan social media, news report, internet search queries, spotted a news report on a new type of pneumonia in Wuhan, China, rating the urgency at 3 on a scale of 5. So why do AI and data matter during the COVID-19 pandemic? This is the question that we'll try to answer today, thanks to our two speakers that I'd like to welcome. Fabrice Moizan, GM and SVP Sales EMEA and Asia Pacific at Graphcore. Graphcore has built a new type of processor for machine intelligence to accelerate machine learning and AI application. One of the three applications the company is working on is healthcare and life science, which is the subject today. The company raised $450 million with a valuation close to $2 billion. Second speakers today, Jean-Marc Pinguet, personalized healthcare director at Roche France. Roche France, everybody knows, as a global pioneers in pharmaceuticals and diagnostics. So Jean-Marc and Fabrice, welcome.
Thank you.
Fabrice, first question for you. On the tech side, how companies such as Graphcore focused on AI and machine learning can help the world facing this global crisis? By preparing this talk, you mentioned projects with academics. Maybe you can talk to us about it a little bit more in details.
Sure. So good afternoon, everybody. So as you said earlier, Graphcore is building hardware. We build supercomputers that accelerate AI algorithms. Talking about COVID in more specifically, we've been working with very large corporations, with the research centers, and with some startup companies. I'm going to give you an example of our collaboration with a large company like Microsoft, for instance. Relatively early on the pandemic, researchers at Microsoft used the Graphcore technology, the processors, to dramatically accelerate the training of AI algorithm in order to recognize COVID and pneumonia in chest X-rays. The Microsoft team used a couple of different type of algorithms, and they managed to accelerate the training of a model. We call it a model from between 4 to 5 hours on existing technologies that we call GPUs on 30 minutes with an accuracy of 93%. So think about the doctors in hospitals that could take more patients and make a diagnosis much faster. So this is really important, because I would say that what is important with AI as well is that the AI can find patterns and relationships in images or data at level of complexity that human can't easily spot, and at faster speed. And in particular with the COVID-19, where the situation where the output, so the diagnosis, is known, but you don't know the variables and that contribute to it. So having AI help in that domain in very fast moving pandemic is very important. So we've been working with Microsoft. We're working with research centers, people like INRIA, for instance, who are trying to find a new kind of ways to detect pandemia and detect pneumonia and COVID. And we work with startup companies as well. They are new type of startups, not only trying to detect the disease, but also building new kind of drugs.
Thank you very much. Jean-Marc, maybe on your side, from the pharma perspective, how this context has engaged Roche in this pandemic?
Thank you, Samantha. And maybe before starting to discuss this point, maybe just remind what personalized healthcare means for you, because this is in my role every day, is how we are able to bring the right treatment to the right patient at the right time. how we are able to bring integrated solution to the patient and HCP in order to personalize patient intervention all along the patient journey. And that includes prevention, diagnosis, treatment, and following, tracking of the patient. And of course, with that, talking about the importance of the data algorithm make a lot of sense if we want to really develop a more comprehensive approach, which is a unique way to improve the patient care. So this introduction to really emphasize the fact that the COVID and the current situation really bring, I would say, an important and critical use case to put in place more personalized healthcare, because we need to rapidly change the intervention for the patient, to better know what about the disease, to collect the data, what about the treatment, and how we really able to bring the best treatment to the patient. So in this context, when we are Roche, and of course, because we have two entities, Diagnostic One and Pharmacy One, we are very committed to fight COVID-19. But not only this disease by itself, it's also how we can ensure that every patient do not delay its treatment due to this current crisis. And of course, we achieve a number of partnerships all around the world and locally with private and public institutions. And just to give a couple of examples, first of all, we are able to capitalize on the data in order to leverage the data for having a kind of drug repositioning. How we are able to create patient cohorts with a regional group of hospital in order to demonstrate the ability of an existing treatment to limit the inflammatory reaction of the COVID, but also to create a demonstration of the potential impact of a new therapeutics. And thanks to the data partnership, private and public. I can also mention some digital collaboration we could have through the Coalition Alliance Santé with more than 50 partners. And for some of them, we leverage data and algorithm in order to improve the patient access to treatment, not only for the COVID, but for example, in lung or breast cancer, where the patient were a little bit anxious to go to the hospital, and how we educate the patient, how we comfort the patient, and how we are able to maintain the patient at home when it's possible, ensuring the best treatment for them. So in this context of COVID, we can rapidly see in a pharma company perspective the importance of the data and algorithms.
Thank you very much. So as you mentioned, AI applies in very different ways in this specific context. One aims to spot the first sign of the disease, what we mentioned in introduction with HealthMap. The second one is to assess the current state of the epidemic in order to predict, for example, local demand for intensive care beds or ventilators, or to support the work of radiologists, as you mentioned. A particular aspect to which public health authorities, I think, should pay attention is one of the 3 V's of the big data. V for veracity, that is to say, the accuracy and the reliability of the data collected, the famous garbage in, garbage out. Is it still a challenge, an open challenge? And to your opinion, Fabrice and Jean-Marc, what are the other big challenges you're facing here, considering AI and big data? Maybe, I don't know, Fabrice, if you had something on this.
Yeah, I mean, that's a good point. When we started working with companies like Microsoft and big labs and so on at the beginning with COVID, I mean, the biggest issue we had was the lack of data, X-ray data, and think about ML, think of AI algorithm. It's like a machine that needs lots of data to learn, right? And the good thing with AI, it keeps learning because as you bring more data, well, the machine learns faster and more. So I think what was key to us is the availability after a while of new type of COVID-related data sets. For instance, Allen Institute for AI, fairsharing.org is an amazing aggregator of COVID data sources. But what we see here in France now is that we see have databases like the one provided by CHU AP.HP. So, I mean, it's important to have reliable data because
Fabrice, you have a problem with your mic, I guess, or your internet access. So I guess Fabrice has a problem with his internet access. Maybe Jean-Marc, if you want to add something on this. So we were talking about the big challenges we're facing here, considering data and AI. So we talked about diversity of the data itself. We talked about the access of the data and the sharing of the data. Do you want to add something on this? And we will be
for sure. And as you mentioned, the specificity of the COVID situation is we had at the beginning a lack of information, but even in some disease area where we have a lot of data, the key thing is to have a good recognition of the real world evidence to capitalize on AI and algorithm, and that's a critical point we work on. And if I want to take one example we work on, and it's in cancer, but we are able to really leverage the existing huge amount of data we have in hospital in order to bring this data in a more structured way with a good quality. But the question beyond that is how we able, and I'm thinking about different institutions in France, how we are able to accept this data to have a new way to assess, for example, innovation, or for assessing a disease, a cohort, and so on and so on. So for me, you mentioned veracity, but it's for me the key things, and it's a lot of conditions which makes the real evidence accepted by the authorities. Because one more time, in this field, we used to have a very conservative approach by asking more and more data, but sometimes we can already capitalize on existing data.
Right. Fabrice, maybe you come back. You're here.
Sorry, I got disconnected for a few seconds. So
yes, please.
But I think I agree with Jean-Marc again. If for us building AI algorithms, it's all about getting the right level of data and accurate data. So it's very important. Otherwise, it doesn't make any sense. So it's a mix of public and private and data coming from public groups and research groups and governments and also the private groups, and because it's not only about taking care of the existing outbreak, is also predicting the future outbreaks, right? If you get the more information you get from history, will help training the AI machine to become smarter and make sure that next time a new outbreak shows up, well, it's not going to take as long as it took this time, even if it's been extremely fast to get a solution to a problem.
Sure. Good transition. The COVID-19 pandemic has exposed few weaknesses in healthcare system globally. Do you have any recommendation for public authorities or on how to implement technology and more precisely the data and AI? You mentioned in just earlier, Fabrice, with the fact that maybe AI will have an impact on this COVID, but on the next COVID, if it happens to do so. So what's your recommendation to public authorities? You mentioned the private, public, and so on. Maybe you can detail a little bit more about what's your recommendation about it. Maybe Jean-Marc.
Jean-Marc, go ahead.
Maybe not a recommendation by itself, but just which is very important in the current healthcare system is the budget issue is increasing due to the COVID, and the resource allocation should be more and more efficient. And I think one more time we can take the COVID situation as an opportunity to rethink the way we consider the resources, and better and in a pharma perspective, that could also impact the way we assess the innovation. What I'm saying here is, if we bring an innovation, if we're talking about diagnosis or treatment, we have to consider the real impact on the entire patient path. And if we consider what could be the cost of an innovation, if it's diagnosis or treatment, we have also integrated the value of this innovation and the impact and, for example, the cost saving we can have beyond the treatment. And my feeling is, at the time being, the COVID situation helps to rethink a little bit the way the approach, which was very by silo in past. We assess one treatment and then another one, and diagnosis, and why not digital tools. But the COVID situation could help to really embrace the entire patient journey and the entire integrated solution, which really helps to better treat the patient and also to improve the effectiveness of the system. And my feeling is we are moving in this direction, and if the current crisis could help this, that could be a good thing.
Thank you. Fabrice, maybe you want to add something?
Well, I'm similar to Jean-Marc. We strongly believe that innovation is key, and I hope, and I can see that in Europe we start investing a lot in AI technology. I believe Europe was going behind the US and China, because that clearly here is the future, right? We can see that without innovating, without focusing on research, there's no way we're going to be able to cope with a new pandemic. So it's the time not only for for solving pandemic problems, but also in the research of new drugs to push for innovation, invest. Again, private companies, I'm sure, have realized that it's time to invest more, but also for public research to put more money into those kind of investment. And AI, I believe, is somebody said AI is the new electricity. That shows today that AI is a lot of good things, in particular on the healthcare side.
Thank you, Fabrice. Thank you, Jean-Marc. Maybe I guess it's too early to say if and to what extent AI will have an impact and how huge is the impact on the COVID-19 outbreak. But one thing is sure, and you mentioned it, AI is relevant to this outbreak, and in future it will become even more so. Maybe as an closing statement, we can say that one of the long-term applications of AI and big data will be in enhancing cities and favoring the development of healthy, smart, and resilient city. We hope so. Thank Jean-Marc and Fabrice for your thoughts on this panel, and thank you for listening.